introduce our first speaker for the second session, and Dr. Chris Appleton. Dr. Appleton is a professor of medicine at the Mayo Clinic College of Medicine, and Chris has been leader and senior member of the department for quite some time, and he is one of the thought leaders on echocardiology, and specifically with expertise with diastolic dysfunction. So he's going to review with us on the evaluation of diastolic dysfunction and its implication for clinical practice. Chris?
Okay, how many echo people are there? Because, you know, we need to tailor this. If there's not many echo people, it's just kind of principles, because looking at a lot of echoes isn't. So maybe 15, 20%. Okay, so we'll go on principles. This little picture up here on the left is the Doe Mountain hike, which is just down the road a couple miles. That's a really great little hike if you don't have a lot of time. Okay, David, page down or arrow down? There we go. So we'll tie these principles into patient management of diastolic function, if you even believe in that. You know, this is an audience that has probably a variable group of how they manage their patients and what they get out of their echoes. But we'll tie it into the recommendations, the recent recommendations of the American Society of Echo on diastolic function. And I just mentioned that I was on that committee with a lot of friends, and that these are the least liked recommendations, I think. They get the most complaints of any American Society Echo, and maybe by the end of the talk you'll understand why. So if you're an echo person, it's like diastolic function in every patient. Is it worth the effort? That's my wife coming out of Canyon to Shea. This hike was worth the effort. And if you do diastolic function in the echo lab and you're trying to transmit that to the consumer who's not an echo person, it's worth the effort if you put some information